Hello all, I am Dr. Vishwanath, consultant medical oncologist with Apollo Hospitals, Bangalore, and I am here today to state certain myths associated with breast cancer. Myth number 1, majority of breast cancers run in families. So that is a common misconception amongst most of our patients, and they think that most of them are genetically predisposed or they run in families. In fact, that's not true, and 90% of them occur only by a matter of chance or what is called as sporadic. Only 10% of them run in families, and the commonest gene which is associated with this kind of a genetic predisposition is BRCA1 and BRCA2. Now, myth number 2. The other common misconception is that breast cancer is spread by contact. This is again a misconception or a myth, and in fact, it is not an infection that it can spread from person to person. It is absolutely not contagious, and it is a total myth that or misconception that breast cancer is spread by contact. Myth number 3. Breast cancer occurs only in women. This is again a very pseudo thought or a wrong thought which several of our patients have. It can also occur in men. Men also have breasts, but it occurs in only a minority of men, and it is quite rare in men as compared to women. But the fact remains that breast cancer is predominantly a disease of women, but can also occur in men. Myth number 4. Mammograms are painful. So mammogram is nothing but X-ray of the breast, and it is usually done as a screening tool and as a diagnostic tool for breast cancer. And it is generally performed in women over the age of 40 or 50 years to diagnose breast cancer early. Now, the X-ray plates are pressed tightly on the breast, hence the mammograms can cause little bit of pain or tenderness when it is being done, but it is absolutely safe and it does not lead to any breast cancer. Not only that, the X-ray or the radiation involved in a mammogram is quite little and it is absolutely safe. Myth number 5. Trauma is a cause of breast cancer. This again, several of our patients come and mention that they injured themselves and then subsequently they have noticed a lump in the breast. But this is only if you look at the chronology of events, there may be a temporal association or the timing, but then trauma itself does not cause breast cancer, and it is a misconception, and it is mainly that this trauma would have led to the patient probably palpating or feeling the breast, hence would have detected a lump. Now, the other misconception is silicone implants can cause breast cancer. There is very little evidence that silicone implants can cause breast cancer. Again, this is a myth or misconception. Now, the other myth is mastectomy or removal of the breast versus breast conservative surgery. In fact, the myth is that removal of the breast is the one which leads to better survival as compared to just removing the lump, which is called breast conservative surgery. Again, this is a misconception. In fact, long-term data over the last 15 to 20 years has clearly shown that removal of the breast and breast conservation surgery, where you remove only the lump, have got equal survival benefit. It is just that patients who undergo lump removal definitely need radiation. On the other hand, patients who undergo removal of the breast may or may not require radiation subsequently, depending on the overall stage which is detected on the pathology. Now, the other misconception is that stage 4 breast cancer or advanced breast cancer is a death sentence. Stage 4 breast cancer is a totally different subset of breast cancer, and there are different molecular subtypes. There is something called hormone receptor positive. There is another subset called triple negative breast cancer, and then there is a third subset which is called HER2 positive breast cancer. Stage 4 breast cancer is a death sentence. In fact, stage 4 breast cancer is definitely treatable, and there are certain subsets of stage 4 breast cancer called hormone receptor positive stage 4 breast cancer, which have got extremely good survival. Of course, it may not be as good as an early stage breast cancer, but these patients end up living for more than 4 to 5 years and they have good quality of life. Similarly, there is another subset of stage 4 breast cancer which is called HER2 positive breast cancer. Again, with the advent of several targeted therapies which go and block this HER2 gene, these patients end up living long. In fact, in the recent long-term data of a trial where they've used targeted therapy for stage 4 breast cancer with HER2 positive disease, 10-year survival has been close to 40%, which means to state that it is no longer considered a death sentence, and these patients do well even if they have stage 4 breast cancer. A minority of them do have triple negative breast cancer. Unfortunately, these patients don't do that well, and the disease is quite aggressive, and the survival ranges between 2 to 3 years.